Welcome to Epic Primary Care, where we do what's best for you and your health.
Epic was started in 2000. Our main goal was to listen to the patients, get relationships with them, and be able to provide them the care that they really need.
Now here we are almost 20 years later, out of residency, and through the timelines, we essentially had realized and seen this huge paradigm shift in medicine. The practice had grown fairly quickly because when someone would come in as a parent and they would say, "Oh, I didn't know that you also see pediatrics," and then we would essentially wind up seeing the whole family.
We offer many different services at our practice locations to give patients more comprehensive care and for convenience. Some of the services that we offer are physical therapy, exercise physiology, psychology, ultrasound, X-ray, clinical laboratory, and pharmacy.
I feel that the philosophy of Epic is to treat the whole patient, the whole family, the whole community.
Team-based care is essential to what we do because we found that when physicians are one-on-one with a patient, that sometimes things are lost. But when there's a consortium, a collaboration of physicians and clinicians who have different backgrounds, when they're actually going over a patient's care, they actually will be able to come back with more breadth and depth of what needs to be done with that patient.
We want to make sure that the patients get the absolute best care possible. And so we do that by having two sets of eyes look at all the patients, both the mid-level practitioner and the physician.
More than one brain is working, multiple eyes are kind of overseeing the same thing. And I think it's really a benefit for the patient because there's more than one way to treat something and there's more than one way to approach. That way you are getting a 2-for-1 deal.
A lot of times patients will say, "Docs, every time I come in here you guys are changing things," and we say, well, that's because we're constantly trying things and we believe in the CQI, the constant quality improvement. We're going to try something. If it doesn't work, we'll go back to the drawing board and we're going to continue trying new things.
We're dedicated to those dedicated to their health. We put a ton of effort into trying to improve our own skill sets so we can get patients better. Then we ask for the patients who come in here to be willing to do the same. We're dedicated to their patients as long as they're dedicated to put in the effort to get themselves better. And we'll continue to improve, and we ask the same for our patients.
The benefits that I provide to the patient is that once they leave, I kind of work with our practitioners here to create and individualize a care plan for each patient based on their conditions and their needs. Just being that advocate person for them as well to make sure that we're on top of their care at all times.
We do handle everything from referrals to medical records to prescriptions. We identify barriers for patients. We've been doing it for over 15 years of coordinating everything outside of procedures being done and hands-on things in the office.
Having all these services under one roof allows us to go from symptoms to diagnosis to treatment much quicker.